The other topic which we are going to discuss is anti-diarrheals. So this is also one of the most important topic which is related to GI disorder. So, what is diarrhea? So diarrhea is a condition where there will be frequent stool elimination, or else where there will be excess fluid loss from the body in the form of stools. There will be frequent fluidity loss, there will be frequent weight loss also in this diarrhea condition. This diarrhea exists in two forms, that is acute form as well as chronic form. So this acute diarrhea occurs as a onset, it occurs very rapid in the healthy patients. The onset of this acute diarrhea in the healthy patient is unknown. We can't predict when does this diarrhea occur. It has several reasons why it is occurring, but we can't predict the time for that occurrence of this acute diarrhea. And this acute diarrhea, it lasts for about 3 days to 2 weeks, and it reduces, or else this condition can be terminated, or this condition can be resolved before any previous injury or else previous disease. If a person is suffering from any previous injury or previous disease, this acute diarrhea cannot have any relation with that. It resolves as such. This chronic diarrhea, once it occurs because as a side effect of various drugs. It occurs because of the various diseased conditions, and it lasts more than 3 weeks. This acute diarrhea shows symptoms like the person will have severe fever, chills, vomiting, loss of appetite, there will be weight loss, and frequent stool excretion, or as frequent excretion of gastric contents, and weight loss and rapid fluid loss out of the body. What are the causes of diarrhea? So there are common causes of diarrhea, like the dietary abuse. In the sense, if a person don't take, or else if a person is not taking proper diet, or else the dietary food is contaminated, the water or food which we take is contaminated, and it is because of infections of various bacteria, virus and protozoa, and it is because of reaction of some medication. That is, if a medication does not show its proper effect, or if a medication showing its side effect, there are few drugs which have the side effect of diarrhea, and if a person is suffering from intestinal disease. So these are the common causes of diarrhea. Here in the pictorial representation we can see the protozoal, viral or bacteria oocyte which is present. The oocyte, once it gets contaminated with, if a food is contaminated or water is contaminated with this bacterial, viral or parasite oocyte, if a person consumes that contaminated food or water, this thick-walled oocytes, it enters into the gastric contents, or else it enters into the gastric region of that particular healthy person, and thereby it causes disturbances in the GID and diarrhea may occur. What are the main causes of diarrhea? What are the causes of acute diarrhea as well as what are the causes of chronic diarrhea? In the acute diarrhea is mainly caused because of bacterial infection, viral infection, or drugs or medication reaction, and nutritional losses, or if there is any nutritional deficiency, and because of protozoal infection. And thus chronic diarrhea occurs because of any tumors in the GIT, or if a person is suffering from diabetes, or in the Addison's disease. Addison's disease is a condition where there will be improper secretion of hormones from the adrenal gland. The adrenal gland will not secrete the hormones which are to be secreted by itself in proper amount, or there will be improper or infrequency in the secretion of hormones from adrenal glands. So this condition is called as Addison's disease, hypothyroidism and irritable bowel syndrome. In these conditions, the chronic diarrhea may occur. And what are the causative pathogens? So what are the infections caused by various microorganisms? Let us see the bacteria. There are various bacterial species which causes diarrhea. For example, Campylobacter jejuni. This is one of the Campylobacter species. And Salmonella species, Shigella species, Escherichia coli species, Clostridium perfringens, Clostridium botulinum, gastrointestinal tuberculosis, Bacillus species, Staphylococcus enterocolitis. These are few of the bacteria which causes diarrhea. These bacteria which when enter into the human body from the infected person, or else from this bacteria which is present, it enters in from infected person into the healthy person, then it forms oocytes. These oocytes are the active forms. These oocytes, they undergo the process of division. They undergo the process of mitosis and mitosis, and thereby they divide into spermatogenetic oocytes, as well as male gametocytes and female gametocytes, and they form oocytes. And these zygote, they undergo division, and thereby they form various bacterial cells in the body, and that is why they cause these bacteria, which when entered into the gastric contents, they cause irritation to the gastric mucosa, and because of that increased peristaltis movements occurs, and thereby there occurs diarrhea. And what are the viruses which causes diarrhea? They are rotavirus, norovirus, and adenovirus. These are the viruses which causes diarrhea. And protozoa, there are various protozoan microorganisms which causes diarrhea. For example, Entamoeba histolytica and Cryptosporidium and Giardia intestinalis and Schistosomiasis. So these are few of the protozoan microorganisms which causes diarrhea. Who or else which group are more prone to diarrhea, or else the persons or the group of people who have high risk for diarrhea are the persons who have the habit of eating only one particular food, or as junk foods we can say, and for travelers, a person who travels very frequently, and if a person is immunodeficient, or else his immune system is very weak. So this bacteria or protozoa virus which when enters into the body, this immune system will act as a defense mechanism, and thereby they engulf the bacteria or virus or these microorganisms, and thereby they won't allow the microorganisms to show their effect. So if a person is not having proper immune system, or if a person is suffering from immunodeficiency, then this diarrhea may occur. Not only diarrhea, there are various immunodeficiency disorders also. These may occur, and daycare participants and institutionalized persons. These are the group of people who are more prone, or else who have high risk of getting diarrhea. What are the pathophysiological mechanisms, or what are the mechanisms behind the pathophysiology of this diarrhea? So this diarrhea mainly occurs because of the changes of intestinal motility. So this intestinal motility can be increased or changed because of various reasons. For example, by the action of acetylcholine, or by the action of histamine, or by the action of various chemical mediators present in the body, they act, or else they promote the contraction and stimulation of the smooth muscle. When this promotion is occurred, then thereby there will be changes in the smooth muscle contraction or relaxation. It may show either increased effect or decreased effect. In increased condition, or else increased contraction of smooth muscle, it causes diarrhea, and decreased condition, it causes constipation. And if there will be any changes in the active ion transport, so there are various active ion transports present in the body. So what does it do? They exchange ions which are required for electrolyte balance. So if these electrolyte ions are increased in more amount, there occurs more reabsorption of water. If water is more reabsorbed into the renal system, or else if water is more absorbed into the system, and if peristalsis movements occurs, then there will be heavy loss of fluids out of the body. And increase in luminal osmolarity. If there is any increased osmosis in the luminal region of the kidney, in the kidney region or in the intestine region, in the lumen part, if osmosis occurs, osmosis is movement of molecules. If this osmosis occurs or else if this osmosis crosses its threshold limit, then what happens is like excessive fluid loss will be taking place, and increase in the tissue hydrostatic pressure. So hydrostatic pressure is a pressure which is created in the tissue against the gravity of the molecule. So against the gravity, if a molecule is exerting some sort of pressure, then that is called as hydrostatic pressure. So if there is any tissue hydrostatic pressure also, there are chances of getting diarrhea. And what are the clinical features, or else how we can say the person is affected from diarrhea clinically? One is by observing the stools. The person will have loose stools, and sometimes they have blood stained stools, and they have some offensive smell, and there will be some offloading of oily or else some sort of abnormal things which are seen in these stools. So this is physical examination. And the other one is the sudden onset of bowel frequency. Because as I told you, we can't estimate or predict the time for acute diarrhea. So if there is any sudden onset of action of bowel frequency or bowel syndrome also, we can say the person is suffering from diarrhea. And the other one is by observing if a person is having severe abdominal cramps, or if a person is having nausea or vomiting, or if there is any loss of appetite or loss of weight. In all these conditions, we can predict somewhat that the person is suffering from diarrhea. What are the complications of diarrhea? If the diarrhea exists in severe condition, what happens? So in diarrhea, there will be rapid fluid loss. If fluid loss is occurring out of the body, the fluid should be lost out of the unwanted fluid which is present in the body should be lost out of the body, and it is excreted out in the form of urine, or it is excreted out in the form of sweat. But if there is any excessive loss of fluid out of the body, then rather than which is required, then it causes dehydration. The person will be completely dehydrated, and there will be electrolyte deficiency. The electrolytes which are available in the body, there occurs deficiency of these electrolytes, and it causes hypovolemia. Hypovolemia is a condition where the volume of the blood in the circulatory system is decreased, or the blood volume, the fluid which is present in the blood is not available in the systemic circulation. So it causes hypovolemia. If this condition occurs, or if this condition persists for a longer period of time, it may lead to hypovolemic shock, and it causes irritation to the anus, and it causes sometimes, if the electrolyte loss is more, then it causes shock and cardiovascular disorders, hypokalemia, and it may cause metabolic acidosis also. How we can diagnose or how we can say that the person is suffering from diarrhea? One thing is like physical examination. By observing the person physically, we can say that if there is any loss of weight or loss of appetite, or by observing the patient we can say. The other one is stool culture. The stool of that particular person is collected, and it is cultured by streaking method, and thereby by observing the stools under the microscope, or by the bacterial culture which is developed in the agar plate. The agar plate is taken. Agar is a semi-solid form, and this agar is agar culture which is there. We have to culture that bacteria on the agar plate, and we can see the formation of bacterial colonies on that agar. So based on these formation of these bacterial colonies, we can say whether the person is suffering from bacterial, viral, or protozoal kind of this diarrhea, and we can give the treatment along with that. And we can see the elimination of WBC also out of the stools. By observing stools under the microscope, we can see the WBC in that, and we can observe, we have to go for blood test also. And the other one is review of your medications. That is, we have to see the medication history. If a person is already taking few of the medications, but we told the diarrhea is one of the side effect of few of the medications. So we have to see the patient medical history. If he is taking the medications which have the side effect of diarrhea, then that should be stopped for short period of time. And the other one is ELISA test. That is enzyme linked immunosorbent assay. So by performing this assay, we can predict whether we can say that if a person is suffering from diarrhea or not. What are the treatment which is given? There is non-pharmacological treatment as well as pharmacological treatment. So non-pharmacological treatment. So this non-pharmacological treatment is given by two ways. One is through diet. So if a person is suffering from diarrhea, we should make sure that the person is not taking any solid food for almost 24 hours. And he should be given only fluid foods like fruit juices, soups, and these should be given for a patient for almost 24 hours if a person is suffering from diarrhea. The other one is oral rehydrating solutions, OROS. So these should be given. We saw that in severe diarrhea conditions, it causes dehydration for that patient, where there will be loss of electrolytes. So these ORS solutions, these oral rehydrating solutions, if we give to that particular person, they regain the electrolytes in the body, and thereby the person can be cured, or else the person can be aided to some extent. And these orals contains the electrolytes like glucose, sodium, potassium, chloride, citrate, and this osmolarity of the oro should be maintained. And what are pharmacological treatments, or what are the drugs used in the treatment of diarrhea? See, these drugs are used in chronic treatment. For acute treatment, these can be cured by through diet or orals. But in chronic conditions, this diarrhea should be treated with the drugs like opioids and its derivatives. So these opioids and its derivatives, they include drugs like loperamide, codeine, defenoxin, and resicodotril, and diphenoxylate with atropine. So these are few of the drugs which are come under the category of opiates and its derivatives. And the second category of drugs are adsorbents. In this category of drugs, it includes drugs like kyolin, pectin, bismuth subsalicylate, and lactose. The other category of drugs are anticholinergic drugs. Anticholinergic drugs include drugs like hyoscine and dicyclomine. And the other category of drugs are alpha-2 adrenoreceptor agonists. So this category contains a drug called clonidine and somatostatin analog. Somatostatin analog contains octreotide, and it contains the other category of antidiarrheal drugs are probiotics, that is lactobacillus sporogenes. Apart from this drug treatment, antimicrobial therapy should also be given, because these diarrhea is caused because of the microorganism infection. So bacterial, viral or protozoal infection, we have to predict based on the diagnosis. After the diagnosis, we can say whether it is bacterial, viral or protozoal infection, and the treatment is given accordingly. For example, if a person is suffering from bacteria, or else if diarrhea is caused because of Shigella species, then the drugs which are preferred are Cipro and Norflox. And apart from the TMP SMZ, this is like trimethoprim and sulfamethoxazole combination. So this drug should be preferred. And if a person is suffering from salmonella infection, quinolins and ceftriaxone are given. And for Vibrio cholerae, doxycycline, tetracycline and erythromycin are given. And for E. coli, Cipro and Norflox are given. And for Clostridium difficile, metronidazole and vanco are given. And for Cryptosporidium species, paramomycin is given. And for Isospora species and Cyclospora species, TMP SMZ are given. Let us see in detail the category of drugs. So opioids. What are these opioids? So these opioids are the drugs which bind to the opioid receptors and exert their actions. There are various types of opioid receptors like mu, delta, gamma receptors. So these mu, delta, gamma receptors are the one, there are various opioid receptors present. So these opiates, they go and bind to those opioid receptors and exert their actions. And one of the effect of these opioid receptors is that they aid into the, or else they aid in the decreased smooth muscle contraction. So whatever the organ it may be, they aid in the smooth muscle contraction or else they decrease the smooth muscle contraction. So when these opioids are given, they just bind to those opioid receptors and they decrease the smooth muscle contraction, and thereby they decrease the GI motility. So there will be decreased bowel contents, and there will be decreased transit time through the bowel. The transit time, the time which is spent by the gastric contents in the gastric region. So this transit time of the bowel will be increased, there will be decreased, so that based on that the water or electrolytes which is there, more water or electrolytes will not be reabsorbed. If bowel contents are for longer period of time in this abdominal gastric region, then more amount of water and electrolytes are added to that bowel contents. So if the transit time of this bowel contents is decreased, then the water or more amount of water or electrolytes which are reabsorbed into the this bowel contents will be reduced. If that is reduced, then excessive fluid loss out of the body is reduced. The drug which come under this opioid and its derivatives is loperamide. So loperamide, what does it do? It increases anal sphincter tone. So there is a sphincter which is present, or else which regulates the bowel contents out of the anus, I mean from the body, from the anus region out of the body. So there is a sphincter. So this low pyramid, it increases the tone of that anal sphincter, and thereby the regulation of the, or else the more amount of excretion of body fluids out of the body can be regulated. And it also have anti-secretory activity against cholera toxins. So E. coli is a bacteria and it contains some sort of toxins. So this low pyramid has anti-secretory effect for E. coli toxins. So E. coli, once it enters into the body and low pyramid is taken, it allows, or else it won't allow the E. coli to secrete more amount of toxins into the body, and thereby the action of E. coli toxins can be reduced. And the half-life of this particular drug is about 11 hours. When it has a very good half-life, and the dose which is given, the loperamide dose is that 4 mg is usually recommended. Initially 4 mg is given, and 2 mg is added in extra for every stool. If a person is having frequent excretion of bowel contents, for every one stool then 2 mg of drug is added, and thereby the dose can be exceeded, or else the dose can be given up to 16 mg per day. But this low pyramid is not recommended for children below 2 years. And Resicadotryl. Resicadotryl is one of the opiate derivative, and this resicadotryl is a dipeptide. It contains 2 peptide chains, and where these 2 peptide chains are bonded with disulfide bond, and it blocks the enzyme called as encephalinase. Encephalinase is an enzyme which promote the release of enkephalins in the intestinal mucosa. So these enkephalins are the biological mediators, or we can say these are the allergens which mainly increase the tone of smooth muscle, or else there will be increased contraction of the smooth muscle because of these enkephalins. So these enkephalins are released into the body in the presence of an enzyme called as encephalinase. So this resicadotryl, it blocks that particular enzyme, and it aids in the decrease the secretion, or else it blocks the secretion of enkephalins in the intestinal mucosa, and thereby there occurs decreased tone of smooth muscles. Bismuth subsalicylate. So bismuth subsalicylate is a trivalent bismuth compound. I mean, it contains 3 valence, or else 3 ions, or else 3 molecules. For example, it is a combination of magnesium, aluminium and silicate. So when these 3 atoms or molecules are combined and they are prepared or formulated in the form of clay, and they are it is prone to extraction, and this trivalent bismuth or as bismuth subsalicylate can be marketed, and it also have astringent effect as well as protective effect also. And what does this bismuth subsalicylate do? Once it enters into the stomach, it reacts with the HCl, and with this HCl, when bismuth salts is combined with this HCl, it forms salicylic acid as well as bismuth oxychloride. What are the side effects of these opiate derivatives? So these opiate derivatives mainly or commonly have side effects like drowsiness, giddiness, headache, anorexia, nausea, vomiting. These are most common side effects. But these opiates, if they are given for long-term use, they may cause constipation. And the very rare side effects which are associated with these opiate derivatives are respiratory disorders, or there occurs respiratory depression, then urinary retention, and there occurs bradycardia, that is decreased force of contraction of heart, and there will be flushing, rash like side effects. The next category of drugs are adsorbents. So adsorbents are the substances, they form a protective layer against a liquid form, or else they form a protective layer against a fluid. So when these adsorbents form a protective layer, then the amount or else the addition to that particular fluid will be reduced. So it coats the walls of the GIT. When it forms a coat, then the water or fluids or electrolytes which are to be reabsorbed into the gastric region will be decreased, or else it won't allow the electrolytes of water to be reabsorbed into the gastric region. So once water is not reabsorbed, then the gastric content, fluidity, or else the increase in the viscosity of this gastric contents will be reduced, and thereby there occurs decreased excretion of decreased loss of fluids out of the body. And one of the good mechanism of these adsorbents are they bind to the causative bacteria or toxins. So these adsorbents, they go and bind to that particular bacteria or else particular toxin, and they directly eliminate it out of the body, and they won't allow the toxin to show its actions. What are the side effects of these adsorbents? So these adsorbents have side effects like increased bleeding time. So these adsorbents, they increase the bleeding time. So bleeding time is the time which is taken for the blood to bleed out, or else the time which is required for the blood to bleed. So if this bleeding condition is increased, then bleeding time is increased, then it may lead to a condition called as hemorrhage. And for longer use, these adsorbents may cause constipation, and thereby there will be dark stools observed, and there will be confusion to the patients, and there will be hearing loss. The patient can't hear properly, and tinnitus. Tinnitus is nothing but a condition where tingling sound can be heard. Actually, there won't be any sound, but we can hear some sort of sound, tingling sound in the ear, and we can observe blue gums in that patient. The next category of drugs are anticholinergics. So anticholinergics are the drugs, they decrease intestinal muscle tone. How does they do? So acetylcholine is a neurotransmitter. This acetylcholine, this binds to the cholinergic receptors. So there are two types of cholinergic receptors, muscarinic receptors and nicotinic receptors. So these muscarinic receptors are again of 5 types, M1 to M5, and nicotinic receptors are through 3 types, that is N1 to N3. So this acetylcholine will bind to either muscarinic receptors or nicotinic receptors and exerts its actions. So from the synaptic nares of the nerve, the acetylcholine is released into the synaptic nares, and in the synaptic nares, these cholinergic receptors are present. So this acetylcholine will bind to that receptors and exert its actions. So one of the main effect of this acetylcholine is increase the smooth muscle contraction. So these anticholinergics, they won't allow the acetylcholine to bind to that cholinergic receptors, and thereby there will be decreased the smooth muscle contraction. The side effects of this, what are the side effects of these anticholinergics? So the anticholinergics like hyoscyamu, the main side effects of these anticholinergics is like they have dry mouth, blurred vision, urinary retention, headache, nausea, vomiting, and in severe condition, the person may suffer from hypotension, bradycardia, tachycardia, and photophobia. The person will be phobic for clicking pictures. The next category of drugs are alpha-2-adrenergic receptors. The only drug which is used as an antidiarrheal under this category is clonidine. So, alpha-2-adrenergic receptors. So, the adrenergic receptor also there are 2 types, alpha as well as beta type of receptors. Alpha also we have 3 types, alpha 1 to alpha 3, and beta also we have 3 types, beta 1 to beta 3. So clonidine is a selective alpha 2 adrenoreceptor. So this clonidine will bind to only alpha 2 receptor, and thereby it won't allow the neurotransmitters like epinephrine and norepinephrine to exert their action, and thereby they decrease the smooth muscle contraction. And what does it do? This clonidine, it also inhibits the secretion of fluids and electrolytes. So whatever the fluids or electrolytes which are secreted or reabsorbed into the body, this clonidine will inhibit that. So thereby it won't act, or it won't add more amount of fluids to the gastric contents, and it is used in diabetic diarrhea as well as opioid withdrawal. So if a person is taking opioids and suddenly if he stops taking opioids, then it may occur opioid withdrawal syndrome, and one of the effect of this opioid withdrawal syndrome is diarrhea. So in this condition, opioid withdrawal diarrhea as well as in diabetic diarrhea, this clonidine is very effective. And the other category of drug is octreotide. So octreotide is a somatostatin analog. So somatostatin is a 14 peptide compound, or as 14 amino acid peptide, which is released into the in the GI cells, pancreatic cells, B cells as well as enteric nerve cells. So the somatostatin have the effect of decrease the gastric motility, or else it slows the GI motility, as well as it inhibits the various secretions in the body. So this octreopeptide is an analog of somatin. It similarly looks like somatin, and this is also a 14 amino acid peptide. So what does it do? It inhibits, or else it decreases the gastric motility. It inhibits the secretions which are secreted by the pituitary gland. It inhibits the secretions of intestinal region, and it also inhibits the secretion of gallbladders. When these secretions are inhibited, then what happens is, like, if the secretions of GI are inhibited, or as the GI motility is reduced, then definitely the diarrhea can be reduced. And apart from that, this octreotide have the inhibition of fluid secretion. Whatever the excess fluid which is present in the body in diarrhea condition, it is because of the fluids which are secreted into the circulatory system because of various glands. So this secretions, extra fluid secretions which are secreted into the circulatory system, can be inhibited by this somatostatin analog. And initially we should give the dose of about 50 microgram through subcutaneous route, and it should be given 1 to 2 times a day. And based on the severity of diarrhea, the dose can be increased up to 600 microgram, and this dose should be given in about 2 to 4. This 600 microgram should not be given at a time, but this dose can be given up to 2 to 4 doses, and it is administered to the patients through subcutaneous route.